when it comes to a career in health. Now, our next guest can certainly attest to that. Dr. Kristen Lee is a doctor of pharmacy with over 20 years experience as a healthcare provider. And Christine created Optimal Life. It's a program that consists of easy-to-use self-educational books and DVDs that empower individuals to become better educated about their own healthcare needs. So a big warm welcome to Dr. Lee. We'll be talking about some really great health topics for you today. So welcome to the show. Great to have you here. But let's talk to our viewers about Optimal Life. What exactly is it?
Well, Optimal Life empowers people to take control of their disease state. It also provides books and DVDs about diseases such as asthma and diabetes. And it tells you why it is so important to understand your disease state and why you need to take control. I say I demystify medicine because I make it simple to understand so you can work better with your doctor.
That's great. It's really important that people know how to get the best out of the relationship with their healthcare provider. And you'd mentioned diabetes, and I know some Optimal Life products do focus on that. And from what I understand, there can be some really serious complications from diabetes if people don't take control of it. So what do our viewers need to be aware of?
Yes, you're right. There are serious complications, dangers of hurting your kidneys, your eyes, as well as your nerves, and you have to be very careful with this. And the most common complication is heart disease, and heart disease is the leading cause of death with people who have diabetes. Now, that's the scary part, but the good news is you can prevent or slow these complications, and I'm going to show you how to do that. Also, you can get in better health even if you have not taken care of your diabetes in the past.
Really? So it's never too late to start.
Absolutely.
You can start right now. And I never knew that there was a relation between heart disease and diabetes. That's something new for me to learn today. But let's talk about the causes of the complications of the diseases. What causes this?
Well, the complications of diabetes, there's multiple mechanisms, but the simplest three answers I can tell you is high blood glucose, high blood pressure, and high cholesterol. Now, high blood glucose damages your eyes, your kidneys, and your nerves. The longer you have had high blood glucose and the higher it has been, the worse the complications can become. Now, for high blood pressure causes damage of the heart, the arteries, the eyes, and the kidneys. High LDL, as well as high triglycerides and low HDL, causes complications of the heart and the arteries.
Okay, and let's talk about the first one that you mentioned, high blood glucose. I think a lot of our viewers associate that with diabetes.
Yes.
Is it in reality, can people really control that?
Yes, they can, and the first thing they need to do is to get measured. And when they measure in a lab, there's three common tests. There is the A1C, fasting blood glucose, and glucose tolerance. The most used two tests are A1C and fasting glucose. Now, at home, they really should be using a home glucose monitor.
Okay. And you mentioned the test, though. What's the difference between the fasting blood glucose and the A1C?
I'm glad you asked, because there is a difference between the A1C and the fasting glucose. And what people need to know is that there is a large difference in the scales. Now, with the fasting blood glucose is a snapshot in time of where your glucose is at the time that they take your blood test. The A1C is an average of 3 months of your blood glucose.
Oh, wow, it's way more extensive.
Right, and the scale is so different. So an A1C scale is a percentage anywhere from 6 to 12. And the fasting blood glucose is a scale of around 70 to 400 or higher. So you can see how the scales are different. So people that get an A1C of 9 think that that's not so bad because the number is low. But actually, it's very bad because it correlates to a blood glucose of 212. So what that means is over a 3-month period of time, their blood glucose has been in the very high 200s and also has gone low to make an average of 212, which is too high, and you are not in control.
And I can see how that confusion would happen, though, because, like I mentioned, I think most of our viewers are probably most familiar with the glucose level. When you go in for your yearly exam, that's the one that you get. When you're a pregnant woman, that's the one that they usually do to monitor you for gestational diabetes. So if you're not familiar with the A1C, I could see how you would be confused, hence why it's so important to make sure that you are aware and that you have this information that you're sharing today. But the bottom line, though, what is it that our viewers need to do to really get control of their diabetes?
They have to be proactive with their blood glucose, with their blood pressure, and their cholesterol. They need to know what tests, when to take the test, and what their goals are. There's an old saying, if you can't measure it, you can't manage it, and it certainly applies with your health. So when you get your measurement results of these tests, it will tell you if you are managing your diabetes. And what we do with the DVDs and books is we try to give you charts and information on what are the critical tests you need to have done. And today, for your viewers, we're going to be giving them a discount code of OPT1 when they go to check out any of the information, and they can get a 15% discount. So they can learn how to prevent complications.
That's great. And we're not done yet. We got more to talk about here. So everyone, make sure you stick around because we have so much more to cover with Dr. Lee coming up right after the break. Stick around.